There are many nighttime signs of diabetes, and you need to know about these signs because many people ignore them until it's too late, by which time they've had a heart attack or their kidneys have stopped working. One very strange problem you might have at night with high blood sugar is bad dreams, that's nightmares. And what's the connection between the two? There are two different situations that can cause nightmares when you have high blood sugar. The first is low blood sugar, and that doesn't make sense, does it? How can your blood sugar be low if you have diabetes? We'll get to that in a moment. When your blood sugar drops too low, your brain starts working hard to bring your sugar levels back up again because having low blood sugar is dangerous. And your brain does this by making your body release hormones like adrenaline, which will help to bring your blood sugar back up to normal. These hormones make you more active and excitable, and that's not really something you want when you're trying to sleep. One way this shows up is that your brain becomes very excited as well. So you end up having nightmares or very strange dreams. So, what can make you have low sugar during the night when you have diabetes or pre-diabetes? If you're taking drugs to bring down your blood sugar, sometimes these medicines work so well that they can force your blood sugar down so much that it goes lower than it should. Medicines that commonly have this effect, just out of the box, even if you do everything you're supposed to do, include a group of drugs used to bring down blood sugar called sulfonylureas. These include drugs like glucotrol, Amaryl, Diabeta, Diamicron, and Diabinese. And then if you're taking insulin injections, your blood sugar can also drop too low during the night. Another way your blood sugar can drop too low when you're taking these medicines is if you change your routine without changing the amount of medicine you're taking. For example, if you usually eat at night and you skip a meal, if you exercise more than usual in the evening, and if you drink alcohol before going to bed. These are all things that can lower your blood sugar before you go to sleep. So there's less sugar for your medicine to work on. So if there's less sugar in your blood, you actually need to take less medicine. Another problem with drinking alcohol before you go to bed is that it may help you get to sleep faster, but the kind of sleep you get is very light. It's not the deep sleep. And deep sleep is the one that actually refreshes you. Apart from nightmares, there are some other nighttime signs you may notice that are linked to low blood sugar during the night. The first is heavy sweating at night. You may wake up to find your night clothes and bed sheets completely soaked. And this type of sweating mainly affects you from the waist up. That's your upper body. Another sign you may notice from the low blood sugar that can wake you up suddenly during the night is palpitations and a racing heart. This is where you can feel your heart pounding in your chest and beating very fast. Remember we saw earlier that when your blood sugar goes too low, your body releases hormones to get it back up again. These hormones, like adrenaline, are called your flight or fight hormones. And one of the things that your body has to do if it needs to run or protect itself is to get more blood, more oxygen, more fuel to your muscles. But unfortunately, in this case, this is happening while you're trying to sleep. Also, you might be losing a lot of minerals, including magnesium and potassium, in your urine, which will affect your heartbeat. So, replacing these minerals in your diet or with an electrolyte powder can help. This next sign is one of the commonest nighttime signs of high blood sugar that can disturb your sleep and leave you feeling exhausted in the morning. When the level of sugar in your blood is high, your body starts looking for ways to get rid of this sugar, which has now become poisonous to your body. One of the ways it does this is through your kidneys. As this sugar is leaving your body, it takes water with it. And the higher your blood sugar, the more sugar you'll pass in your urine, and the more water you'll need to dissolve it. If you get up once or twice during the night to pass urine, that's totally normal. But with high blood sugar, you can get up 5, 6, even 10 times during the night to pee. Closely related to this is that if you're passing out lots of urine, that means you're losing a lot of water from your body. And your body wants to make sure that you replace that water. So you become very thirsty and you'll be drinking a lot of water throughout the night. When you get your blood sugar under control, then you won't have lots of sugar in your urine, so you'll pass less urine, so you won't be up half the night peeing and drinking water. So let's look at some nighttime signs of diabetes that you may notice in your legs and your feet. Restless leg syndrome is where you have an almost irresistible urge to move your legs when you're sitting or lying down. You may experience strange feelings in your legs like crawling sensation or throbbing or aching. The thing about these uncomfortable sensations is that they get better if you move your legs or you walk about. And then when you stop, these strange feelings come back. And this is usually worse at night. And 3 out of 10 people with diabetes have restless leg syndrome. And if you have to keep shaking your legs all through the night, obviously you're not going to get much sleep. There are certain things that can make this even worse, like drinking lots of coffee, drinking lots of alcohol, smoking, being overweight or obese, being under a lot of stress, and then drugs like diphenhydramine, which you find in many over-the-counter remedies for cough, cold, sleep, and allergies, like Benadryl, Unisom, and ZzzQuil. If you can avoid as many of these triggers as possible, that will help. And then if you don't have enough iron in your body, treating that can make things better. And then supplementing with the B vitamins, especially B1, can help, especially if you're passing a lot of urine because you'll be losing a lot of vitamins that way. Another sign you might have in your legs and feet when you have high blood sugar is severe cramps. Magnesium helps your body to use sugar to produce energy for your body. When you have high blood sugar, your body will use up a lot of magnesium trying to turn that sugar into energy. So you end up with low magnesium in your body. Also, remember that if your blood sugar is high and you're passing a lot of urine, you're losing a lot of minerals like magnesium in that urine with the water. So your magnesium levels will be even lower. Studies have shown that people with diabetes tend to have lower magnesium levels than normal. And magnesium helps your muscles to relax. So when your levels are low, your muscles become tight and crampy. These leg cramps are usually worse at night. To increase your magnesium levels without taking supplements, you can eat food that's rich in magnesium, like leafy green vegetables, legumes, that would be beans, peas, lentils. You can eat avocados, dark chocolate, fatty fish, and nuts and seeds. If you want to take the supplements, Magnesium comes in different forms like magnesium citrate, magnesium glycinate, magnesium oxide, and lots more. Magnesium citrate and magnesium glycinate are well absorbed, but avoid magnesium oxide if you can. It's the cheapest form of magnesium, but very little of it actually gets into your body. Magnesium threonate is fine, but it's quite expensive, and the cheaper forms of magnesium are just as effective. Most people take around 200 to 600 milligrams per day, depending on how much they need. But it's important to start with a lower dose if you're not used to taking magnesium, because too much of it can cause diarrhea. And if you have kidney problems, taking a lot of magnesium may cause problems, so you need to be extra careful with that. Unfortunately, when your blood sugar is higher than it should be, this sugar becomes poisonous to your nerves in several ways. High blood sugar damages your nerves directly. When there's too much sugar inside the nerve cells, they can't use it all up and they become overwhelmed, so they don't work properly. And then all that excess tissue attaches itself to the fat and the protein in your nerves. And the outer covering of your nerves is mostly fat. And when this becomes overloaded with sugar, your nerves can't send messages around the body properly. High blood sugar damages the blood vessels that carry food to your nerves, so they're not receiving fuel and vitamins the way that they should. And what happens to you when you're hungry? You're irritable, you might snap at people around you, you might feel weak, you won't be able to do the work that you're supposed to do, and really, that's what's happening to your nerves. Some of the feelings you may experience include a burning sensation, tingling, pins and needles, electric shocks, numbness or no sense of touch, being very sensitive to touch, and then feeling like you're walking on glass. Ultimately, the best way to solve this problem is to do everything you can to bring down your blood sugar, because the nerve pain usually comes down as your blood sugar comes down. There are also supplements that can help, like alpha lipoic acid, turmeric, acetyl L-carnitine, N-acetylcysteine, and B vitamins, especially B1, B6, and B12. But these will work best if you're also bringing down your blood sugar at the same time. So imagine this. You're sleeping peacefully and the tube that carries air from your mouth to your lungs keeps collapsing. When that happens, your breathing stops. That's called obstructive sleep apnea, and it can happen dozens of times during the night without you knowing. Every time your breathing stops, your body goes into panic mode. Your brain wakes you up just enough to restart your breathing. And that's why you might feel groggy or foggy the next day, even if you think you slept all night. Having insulin resistance and high blood sugar makes this worse in several ways. High blood sugar can lead to high insulin levels, and insulin is a fat storing hormone. If you've gained weight, especially around your neck, it can squeeze your airway when you're lying down, making it harder for air to pass through. Diabetes also causes inflammation throughout your body, and this swelling can narrow your airway even more, making blockages more likely. High blood sugar also damages your nerves over time, including the ones that control your throat muscles. And if these muscles can't stay strong and open, your airway collapses more easily. Diabetes often causes your body to hold on to extra water, and during the day, this water will sit down in your legs. But when you're lying down, it spreads out and moves upwards, and it can press on your airway, making it harder to breathe. So when your airway gets blocked, your body reacts fast. Without air in your lungs, oxygen in your blood drops fast. Your brain sends signals to your body to release adrenaline, that's your fight or flight hormones, to wake you up so you can breathe again. That adrenaline doesn't just wake you up, it also raises your blood sugar. So the sleep apnea isn't just about feeling tired. Over time, it can cause extra strain on your heart and increase your risk of having a heart attack or a stroke. There are a few things you can do to help. If you lose 5 to 10% of your body weight, that can reduce the fat around your neck and help to keep your airway open. You can control your blood sugar by eating more natural food and eating fewer carbs and exercising regularly, which can reduce the inflammation and the insulin resistance. And then also using a CPAP machine, which delivers a steady stream of air to keep your airway open at night. This can help as well. The next sign you might see at night when you have insulin resistance and diabetes is related to your blood pressure. Your body has a natural rhythm, a cycle that it goes through every day. At night, while you're asleep, your blood pressure should come down. This gives your heart a chance to rest. But with high blood sugar, for some people, the blood pressure doesn't come down at night, and it might even go up. And there are a couple of reasons for this. High blood sugar damages the walls of your blood vessels over time, making them stiff. Stiff blood vessels don't relax as easily, so your blood pressure stays high. Diabetes can also strain your kidneys, and when they struggle, they release hormones that raise your blood pressure even more. Cortisol, that's your stress hormone, should drop at night, but with high blood sugar, it often stays high, keeping your body in a ready for action mode when it should be relaxing. Not breathing properly and low blood sugar during the night both make your body release your flight or fight hormones, which will raise your blood pressure. So there's a tube that goes from the back of your mouth down to your stomach. Where this tube enters the stomach, there's a valve like an elastic band. What this does is that it allows food to go down into your stomach, but it doesn't allow it to come back up. This band is controlled by your nerves. When these nerves are damaged by high blood sugar, the band relaxes when it shouldn't, and the food, which has now mixed with the acid in your stomach, comes back up. And then you feel that pain from the acid burning the inside of the tube. And what can you do about this? You can try cutting down on starchy food, high carbohydrate foods like potatoes, rice, bread, pasta, and get some more exercise, and this will help to bring down your blood sugar. You can eat your food earlier in the day. Even if you eat in the evening, eat small meals so you don't have a big lump of food sitting in your stomach when it's time to sleep. And then propping yourself up with a pillow instead of lying down flat while you sleep. That would be a good idea. So we've looked at some of the signs that you might see at night when you have high blood sugar that can wake you up while you're asleep. But when you have high blood sugar, sometimes even falling asleep can be a huge problem. So to make it easier to fall asleep, sleep in a dark room, avoid screens like phones and computers and bright lights before you go to sleep, and then do something relaxing like reading or stretching before bedtime. And basically doing everything you can to bring down your blood sugar. That is the one thing that will make all these signs go away. And I'll show you how to do that naturally in the next video.